Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we're going to look at one important occupational lung disorder. So this is nothing but the silicosis. So the headings we are going to cover will be, first is we are going to see what are the risk factors involved. Then we will talk about the types of silica. And we are also going to talk about the pathogenesis, the clinical features, as well as the investigations and the prognosis. Then most importantly, the radiological features as well. So let's break it down. Starting with the risk factors. The risk factors of silicosis is mainly it is the mining industry, blast furnaces. So mining industry, blast furnaces are the important ones. Then there is also the quarries, the slate industry, the sandstone industries, ceramics, and also the rock cutting. Then moving on to the types of silica. The types of silica, there is something known as a crystalline silica. It is the most common. So it is also known as the quartz. Crystalline silica or the quartz. This is nothing but the most common. And the composition is, it includes the free silica, that is a SiO2, and the higher risk of occupational hazard. So this is the higher risk of occupational hazard. The second variety, first was a crystalline, that is a quartz. Second one is going to be the amorphous silica. So now let's look at some features. So we are dividing into the acute and the chronic. So let's discuss both of them. So in case of the acute, there is the occupational exposure of large quantities for over 12 years. So acute means it is 2 years. Chronic means it is about 10 to 30 years. So almost decades, 1 to 3 decades. And looking at the pathogenesis, in case of chronic, it is nothing but the injury to the pulmonary alveolar macrophages. So you have injury. The injury is to the pulmonary alveolar macrophages. The pulmonary alveolar macrophages, and this can in turn be due to the silicotuberculosis, or it can be due to the immunocompromised conditions such as SLE or the RA. So it is due to the silicotuberculosis, that is reactivations of the latent TB, and the autoimmune illness such as the SLE or the RA. Now let's look at the conditions, the clinical features. The clinical features in case of acute and the chronic, clinical features, it includes there is severe dyspnea, there is hypoxia, as well as there can be weight loss. So dyspnea, hypoxia, as well as weight loss. So this forms an important triad of the acute. Then when you look at the chronic, it is going to have the dry cough, dyspnea, as well as the chest-based signs. So chronic cough, so it has cough. Then comes the dyspnea on exertion, as well as, so dyspnea is common in both. So dyspnea on exertion, whereas in acute there was severe dyspnea. And there is also chest signs. Chest signs accounts to about 25%. Now looking at the investigations which are suitable. In terms of acute, it is going to be the PAS positive and milky white BAL. So it is going to be PAS positive and the milky white BAL. Milky white BAL. Next, when you look at the chronic silicosis, the pulmonary function test, there is a mixed pattern on spirometry. So when you look at the PFT in terms of chronic, there is going to be a mixed pattern on the spirometry. So spirometry is going to be completely mixed. Prognosis wise, the acute is going to be very poor. Then moving on to the very important, that is the radiological features. So moving on to the radio. So here in terms of acute on CT, there is presence of the crazy pavement appearance. This is important. Crazy pavement appearance. So crazy pavement appearance, there is a ground glass opacification. The thickened septa, there is ground glass appearance and thick septa, thickened septa. Then comes the multiple centrilobular small nodules in parenchyma. There is a multiple centrilobular small nodules in the parenchyma. Now we move on to the chronic. So this was about the acute. That is a crazy pavement appearance on the CT. Then looking at the chronic, you can have barrel symmetrical centrilobar parenchymal nodule. So small bilateral, symmetrical, this is all in chronic. Centrilobar parenchymal nodule. And there is a large conglomerate nodules. So this gives an angel wing appearance. So there is an angel wing appearance. Next, they can also have the cavitations may be present, as well as there can be hilar lymphadenopathy with the eggshell calcification. So this is all in chronic. There can be eggshell calcification. There can be a progressive massive fibrosis, as well as upper lobe interstitial lung disease, upper lobe interstitial lung disease. So all this can be seen. So another important aspect to not ignore is the crazy wing appearance, the crazy pavement pattern. So what are some differential diagnoses? So it's important we know this as well. So important in case of the crazy pavement is going to be conditions such as the DAH. DAH stands for diffuse alveolar hemorrhage. Then the AEP, acute eosinophilic pneumonia, and the PAP, that is a pulmonary alveolar proteinosis. So these are some important differential diagnoses. Apart from this, we also had the acute silicosis. So this was all about the silicosis. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.